Hello, everyone. This is Dr. Mike Cho, physical therapist. Hey, today we've got a special guest. Our title for our topic for today is Doctor with a Mission from OR to the World. We'll be back in a few seconds, okay? All right, we are back. I don't know if you are watching live, comment live, watching on the replay, comment replay, but we've got a special guest for today. And our guest for today is, I asked him and I asked Tanya and everybody from her clinic and from this clinic and asked, hey, what's a good topic? And Tanya, the marketing lady, sent me all this information. And gosh, this doctor is very, very impressive. And I told Tanya, hey, we need to bring him here, introduce him to our area here in Northwest Tennessee. So without further ado, I want to introduce him properly, formally here. So this is let me read this properly. So today we got a very special guest who truly embodies the heart of service and surgical excellence. Joining us today is Dr. Matthew Christie, a fellowship-trained orthopedic surgeon specializing in hip and knee replacement. Gosh, this is where we come in, right? He is born and raised in Nashville. He traveled around the world, studying in Boston, researching in Iowa, serving in Nepal, and training across the country, only to return home, okay, and continue his father's legacy at the Southern Joint Replacement Institute. He's not only a skilled surgeon, but also a mission-driven leader working with the Walk Strong Foundation to bring joint replacement and care to underserved communities. Without further ado, let's go ahead and bring in Dr. Matthew Christie. Where's he at? There you go.
Mike, how are you?
Dr. Christie. Well, first of all, thank you very much again for coming over. Appreciate you. I know you're very, very busy, not just as a person, but practice-wise and everything. But could you please tell us again who you are, what do you do, and tell us more about your journey, man, before I ask all those other questions.
No, absolutely. So I'm Matthew Christie, as Mike so eloquently introduced. I'm a joint replacement surgeon in Nashville, so that means I focus almost exclusively on surgery of the hip and the knee, and not just any old surgery, but joint replacement surgery. Those are the things that I specialize in, that I do day in and day out, are joint replacements. That's where I am now, but that barely touches kind of I guess you could call it the origin story. So as you alluded to earlier, I was born and raised here in Nashville. My father is Dr. Michael Christie, who founded the Southern Joint Replacement Institute right around 1997 after a stint at Vanderbilt. And I grew up here, and I ended up going up to Boston for undergraduate studies at Tufts University. And I was there for 4 years. And then I took a little bit of time off because I was trying to figure out what I wanted to do. I spent a year in Iowa doing some research, medical research, and then spent a year in Nepal, in rural Nepal, working at a health clinic with the government out there. Ended up coming back to the States to do medical school at the University of Virginia in Charlottesville, and then residency down in Birmingham at the University of Alabama in Birmingham, and fellowship out at the University of Utah. And you know, when we're talking about an orthopedic surgeon, we all have the option to go out after our residency training, which is kind of our general training, and do a year of specialized training. And I did that year in joint replacement. And so about 4 years ago, I came back from Utah back to Nashville to join my father's practice here in Nashville, and been loving it ever since. I predominantly see patients here in Nashville, but I also see patients out in Dixon, which we get patients all from over West Tennessee out in our Dixon clinic.
I know. I've been seeing your name and everything, Doc. So appreciate that, and of course for your referrals. But you're literally, I don't know if you watched the Avengers. You're literally Doctor Strange. You went to Nepal and everything, right? So tell me about that experience there.
Yeah.
1 year of being there and research. I mean, oh gosh, I mean, I think all practitioners, whether you're a therapist, physician, or a nurse, I think one needs to go out and do some mission work. In that way, you realize how you appreciate our own practice here. We forget that here. So tell us more about that experience there, sir. I mean,
Yeah.
why go to Nepal?
I had some prior experience in China and Tibet in college, visiting out there, and um, really loved the culture of Nepal. Love the scenery, love the people out there, and I wanted to do something. I think a lot of us have trouble, and I certainly had this issue in college and in training of saying, well, how can I be useful with the skills that I have? I was a EMT in college. Driving an ambulance around and picking up people and taking people to the hospital and stabilizing people and everything. And I said, well, there's some skills that I have. I had some knowledge of kind of very basic primary care things, and I partnered with a local 501c3 here in town called Project Cure, which has warehouses all over the country that source durable medical equipment and all sorts of kind of used or lightly used DME to help distribute to other places. I also worked with some pharmacists here to get some medications. And so I walked over to Nepal through an NGO over there called Nepal Orphans Home with 2 big REI duffel bags full of medications and full of medical equipment. They got me set up with a clinic out there to work in this clinic for a year. And that's what I did. It showed me a lot of things. It showed me that, even without specialized skills, you can bring care and hope and dedication to people in low and middle income countries. But it also showed me how much need there is out there and how mission work shouldn't be about going in there with a sack full of supplies, helping for a week and then leaving. That mission work really needs to be about long-term, dedicated commitment to sites. And, when I came out, I went to finish my medical training, and my father started the Walk Strong Foundation, and we're gonna kind of segue into that, but with a similar idea in mind, which is if you're going to go somewhere and if you're going to do something as significant as orthopedic surgery in a low and middle income country with limited resources, you need to be there with the express intention of providing support and providing a sustained commitment to that place for a long period of time. We hear so much about parachute mission work where you go in for 10 days and you do a bunch of work, whether that's cleft lips or total joints or whatever. And then the folks, the local people there never see you again. They never see a practitioner again. And it's unusual for us to I say it's ridiculous for us to believe that what we do in somewhere like Nepal or somewhere like Africa is without complication. And so my father founded the Walk Strong Foundation, and I'm a board member of the Walk Strong Foundation for the sole purpose of developing joint replacement programs to say, hey, we're coming, we're going to help you learn how to do these surgeries. We're going to teach your local surgeon how to do these surgeries. That way you can build your own program, and we'll provide the support. And so that's how I've come from simply showing up with a bag of parasitics in an REI bag as a recent college graduate to still trying to do something similar, but a little more mature now as a surgeon.
Wow. That is such an amazing story, Dr. Christie. I mean, and coming from your dad and to you, and you taking that initiative, I think it just shows your heart there. And like what you said, I like what you said about giving hope, to
Yeah,
the people there, whether they're from a third world country, second, third, fourth, or whatever you want to call it, uh, Christian or non-Christian denomination. I think that speaks volume to you, and of course your dad, and of course Southern Joint Replacement Institute.
yeah,
I also like what you said about teaching, man. So you went there not just to do like a quick missionary, a mission trip. You are actually teaching other surgeons, physicians there on your techniques too, uh, utilizing your whatever skills and techniques that you do, man. That is
yeah.
literally next level. I
No,
want to do
it's
that in the Philippines.
no, and you can. I think we all can. I mean, I think we all have
Hmm.
something to bring to the table. And when we go over, our most recent trip was to Eswatini, which is Swaziland in Southeast Africa, right? And they have this where we were. They have this amazing group there that wants to do this, for their people, and I can come over as a surgeon and I can teach their surgeons. We had surgeons from Kenya that came down, but we also have, people who are experts in central sterile. We have people who are experts in implants and operating room efficiency and physical therapy. And we have everything. Everybody has something to bring when you're talking about building a program. Right? When you're talking about building a self-sustaining program in a low and middle income country, everybody has something to give. And what's really cool is we also have a lot to learn, right? If you're talking about a resource limited environment, I operate in a place where I have every possible gizmo and gadget and robot and every little thing I could possibly ever want. And to operate in a resource limited environment teaches you, that you don't necessarily need all that stuff, or it teaches you what to do if you
Hmm.
don't have that kind of stuff. So it would be remiss of me to say that we go there with the express purpose of just teaching, and we're giving you this, and it's actually very much a two-way conversation and two-way street. So it's been
You know
it's
what?
been great fun.
That is so true. That is so true, Doc. Because I mean, I teach too. I teach CEU classes and everything, but I always tell this to my students. And I'm not really teaching you guys. I am teaching, but I'm actually learning from you guys. And I think this is what you're experiencing there too. That when every time you go there, yes, you're sharing your knowledge, but you see it what they're doing. Oh, I can actually do this without the actual crazy fancy equipment. I mean, I don't
Absolutely.
know. I mean, I'm not an orthopedic surgeon, but in therapy, we have all this, quote unquote fancy equipment. But in reality, we can really just do our own body weight to improve our strength, right? So
That's
uh, I'm sure. I mean, I'm not comparing physical therapy to orthopedic approaches or your tools, but the concept is probably there too. So
Absolutely. I think there's a lot of overlap.
mhm, yeah. So I mean, this next question, Doc, is really not just for you, but also for me because my daughters, they're in PTA school, physical therapy
Mhm.
assistant, and she's going to be a DPT, and my second one, she's going to be an OT. So this next question is that now that you're back in Nashville, what does it mean to you to practice alongside with your father at Southern Joint Institute?
It has completely transformed our relationship. I think when you can have a conversation in an entirely different language with somebody, that's the language of orthopedics, of joint replacement for us. It really deepens the relationship. I have an older brother who's also a surgeon. He's not an orthopedic surgeon, but he's a plastic surgeon, does hand surgery exclusively. And so, I think having a couple daughters who are in therapy says a lot about you, Mike, about what you've shown them to be valuable in life, and that's what my dad did for us. Right? He didn't say you need to go to medical school, you need to be an orthopedic surgeon. No, he demonstrated the value of that work. And that's what led me this direction. That's what led my brother this direction. And it's been an absolute joy and pleasure to work alongside him, as I'm sure
Wow,
you'll get to
wow.
experience with your daughters, right?
I know, right? So, I mean, I see those people who are. I grew up in the Philippines, and there are a lot of Chinese. My dad is Chinese, and there's a lot of Chinese business owner there, and they would train their kids to take over their businesses. And my dad, he had a business, and he was trying to mold me. But during that time, I'm like, I finished up physical therapy school. I think I'm just going to do this on my own. And I wish I took over his businesses, but they're all both of my parents has passed away. But um, when I'm doing this, we open up Jerry have physical therapy. We have several locations, sir. And I always tell this to my kids. We're not just doing this to make money. We're doing this to leave a legacy.
Mhm.
Leaving a legacy for our kids, leaving a legacy for our patients, and and then of course helping out our staff and employees. And that's what I always tell my kids. Hey, you're going to take over the business, not because you want to be the so-called boss, but you want to be the person that your employees look up to, when they have problems and everything like that. Just right now, before we logged in, my wife, she was asking me, hey, do we have any cash advance? One of our staff needs some extra money for something. I said, yeah, we could talk about it and everything. Well, simple stuff like that. Or no, we're not a big company, but of course, Southern Joint Replacement Institute is very big. I see your sign all the time. Every time I go to Nashville, hey, what is up with that Southern Joint Replacement Institute there? Well, the third question, sir, is can you tell me more about that Walk Strong Foundation? I know you mentioned that earlier.
Yeah.
It's you mentioned all these countries, man.
Yep.
Nepal, you mentioned China, you mentioned Africa. What's the next step for Walk Strong
Yeah.
Foundation, sir?
Yeah. I'll kind of give you the history here, and the history is not my own. The history is my father's, but um, he felt that there was a need. He felt that there was a need for high quality joint replacement in low and middle income countries. Um, the problem with joint replacement in, let's say Africa, for instance, is that the implants are so prohibitively expensive. We are talking about thousands and thousands of dollars for an implant. You either get a high quality, expensive implant, or you get a low quality, Pakistani, Indian made implant that fails, that breaks. And so either you have patients that can't afford implants, or you have patients that get these implants that end up failing on them. And so, my father saw the problem. He saw the issue, and he saw the issue as not only one of implant availability, but also one of infrastructure, one of training. And so started the Walk Strong Foundation with kind of the goal of saying, how do we improve this? How do we make this happen? He partnered with an Australian implant company called Signature Orthopedics, and developed low-cost, FDA-approved implants that we use on our patients in Nashville. Okay, so that they're not cheap, but what they are is well-made, excellent, equivalent to anything that we would use anywhere else. It's $500 for a knee replacement, $800 for hip replacement, when traditionally you're talking $5,000, $6,000, $7,000 for those things. They are made of in the same factories, in the same places as any other implant out there, and they're as good, if not better, than many implants that are on the market now. He partnered with this company, and so now we've solved the problem of implants. The next question is, how do we solve the problem of infrastructure, of training? And so what we've done is we've partnered with hospitals in these low and middle income countries. I'm talking Ethiopia, Eswatini, Honduras, Veracruz, Mexico, lots of different sites that have some varying degree of infrastructure and training available, and say, okay, what do you need? Do we need implants? Do we need operating room tables? Do we need suture? Do we need skilled training for orthopedic surgeons, for physical therapists, for central sterile? How do we build a program for you that would rival our own program here in Nashville? And so that's kind of what Walk Strong has shaped itself into, is a program development nonprofit, right? So, we went down to Eswatini, and we've had a couple of surgical, weeks with some folks down in Eswatini, where we help their surgeons learn how to use these implants, right? Implants are very technique dependent. So we taught surgeons how to use the implants. We helped modernize their central sterile, their processing departments. We want to essentially devote ourselves to developing this program, and then we want to make ourselves obsolete. We want to remove ourselves. And I wouldn't say remove ourselves completely, but at least be there as pretty much only a source of, if they have some questions about something, or if they want to run a case by us. I want to set this program up, and I just want to be a source of knowledge for them in the future. And I want to trust that they're more than capable of handling the surgery, any complications that arise, and all those things on their own.
You know what? That's so true. You're actually planting that seed and teaching them and educating them. And then that way they could be really independent in using this techniques.
Yeah.
Man.
Yeah.
When are you going to add a country? You want to add Philippines there?
Sure. Yeah. Why not? Absolutely. I mean, if there's a need, there's a need. Our goal is to assess what's needed and provide that, right? Some places, what we've found out is everywhere is very different. Whether it's, we need training here or this or that, everywhere is just a little bit different. Some places just need implants. Some places need a lot of work to build these things. So,
you know what? You're making my brain work here right now, because like what I said, I teach the dementia class, a certified dementia practitioner class, and I teach it here in the United States. I travel and go to different states, and the APTA, AOTA association, and then here I am, not teaching my fellow Filipinos, and I want to do that back home too now, just because you tickled my brain there. And if you decide you want to add Philippines, I still have connections with the Philippine Medical Association and some pharmaceutical companies there, and maybe we could partner up and then help our Filipinos.
Absolutely,
they have osteoarthritis too. They need to get their knee replaced too.
I mean, we're all longer than we ever have, and that's.
I know, right? We're busy now. A lot of people would say, "Why geriatrics, Michael?" I'm like, you do know that there's a lot of seniors getting older. We need to take care of our seniors, so I'm sure that's your case too, right? At Southern Joint. My next question, Doc, is as a surgeon, what do you look for? Do you have physical therapy there too in your Nashville location?
We do. We have physical therapy in our Nashville location, our Brentwood location. We as
train them too in your certain techniques.
I've done some in-services about what we do. We develop our physical therapy protocols in hand with our physical therapists here to really kind of meet in the middle. I think it's so easy just to send a knee replacement patient off to a physical therapist and just say, do your thing. Right. As an orthopedic surgeon, we're not necessarily trained in rehab. We're not. And so I think to develop these protocols with therapists, to provide it as guidelines for wherever we might send our patients, I think helps us because we have some predictability in rehab. And it helps you guys because it gives you some direction about what we like. And we get a lot of good feedback about our rehab protocols, a lot of fantastic feedback. What I'm really looking for in when I send somebody to therapy, especially if we're talking post-operatively, I'm saying I want you to go here for your 3 days a week for 6 weeks therapy after a knee replacement, is I want communication. Ultimately, I trust the training that y'all receive. I trust that your training plus our protocols are going to yield a good result for the patient. But I want to hear. I love getting updates on my patients to see how they're doing. I love getting texts or phone calls from therapists, even if it's, especially if it's, oh, I got a concern here or something that, I'd rather not hear that from the patient. I mean, of course, I'm going to hear it from the patient, but I want to hear it from y'all first and foremost. We are so conditioned to believe that surgery is done. I've done my part. All right, you go to this black box and make it happen. And I think there's always room for more communication between us and therapy to really ensure that these patients have excellent outcomes.
You know what? That's so true, doc. Because you see the patient probably, after the surgery, maybe after 4 weeks, and here we are, therapists. We see the patient 3 times a week, and then we see them more. Their actual progress and function, and even those, simple wound care. Hey, doc, is this really a normal discharge or what? So, thank you for pointing that out because communication is very, very important that we
Absolutely.
really need to, So, one last question, Doc. I know before you're very busy there. How do you stay grounded and balanced with everything here from, actually working as an orthopedic surgeon, teaching, and then all this outreach? How do you balance this? Do you have family or got kids?
I do, and that's such a huge part. I was going to say, I mean, I think my wife, Courtney, and our 2 kids, we have a 3.5 and a 2-year-old, so it's a little bit crazy. But I think going home and seeing them really, really helps me appreciate what matters. It helps put into perspective what I do, what I strive to do for patients every day, what I strive to do for patients in these low and middle income countries. Seeing my family that, thank God, has very few, knock on wood, if any, medical problems. My kids were born without a problem. They're healthy. Our family is happy. I mean, that is the kind of stuff that gives you such a bigger appreciation of everything, of life, of our profession.
That is so true. That's so true. So again, Doc, thank you very much. Any last parting wisdom for people who are watching? Where can they find you? Or,
Yeah,
telephone number and everything like that.
yeah, please. Matthew Christie. You can find my information at Southern Joint Replacement Institute. The website's down there. 615-342-0038 is our phone number. Happy to see patients, and I want to be very clear that while joint replacement is in our name, it is not the only thing I offer my patients. We talk about non-operative measures. We talk about joint health. We talk about a lot of things with hip and knee. And just because you walk into my clinic doesn't mean that you're getting a surgery. As a matter of fact, for many patients, I try to, avoid surgery as much as we can. But we're about holistically treating your joint pain. I have a clinic every couple weeks out in Dixon, just to avoid that horrible Nashville traffic. And happy to see anybody there. So reach out, please.
All right, well, Doc, thank you very much again. Appreciate you. And but before I let you go, I like what you said about being holistic. And you mentioned about the joint replacement. Yeah, you are correct. When you go to Dr. Christie's place, you're not going to get instant joint replacement. It's like in geriatric, we just don't see geriatric. We see middle-aged people, back pain, hip pain, everything like that. So it's in the name, but I like what he said about being holistic. Doc, again, thank you very much. Appreciate you for your time. But before I let you go, my Facebook and YouTube friends, always remember the word fast, FAST, letter F, right? Letter F. Why? Find people that will bring out the best in you. You are the average of the 5 people you hang out with. If you hang out with people who are, complaining in life, they'll get Today I hang out with an amazing orthopedic doctor, surgeon, Dr. Christie. I feel like I want to do some mission work now, right? So find those five people, people that will bring out the best in you. Next letter is letter A. Take action. All this stuff that we're doing is not going to do because it's not giving up Dr. Christie good. If you don't take action. Go to their website, www.sjri.com or Google Southern Joint Replacement. Take action. Go talk to him. Reach out to them. Hey, how can you help me? Deep pain, and everything like that. Okay. Next letter is letter S. Share, subscribe. Now, shoot for the moon. Why? If you keep shooting for the moon, you're gonna miss it. You're gonna be landing with the stars. I kept shooting for the moon. Dr. Christie, he probably kept shooting for the moon. He's gonna miss it. He probably failed something in his life, but now he's over here. He's teaching people. He's guiding people. He's not just doing it in Nashville. He's doing it globally. Hopefully someday in the Philippines, right? And last but not the least is letter T is teaching. Why? Because when you hear, you forget. When you see it, you remember. But when you're actually teaching it, just like what Dr. Christie is doing, you're actually understanding it more. And that's what he's doing. He's teaching us how to be amazing. Again, thank you very much. Be awesome. Be great. Be excellent. And we'll see you in the next episode of our Jerry Hab Show. Again, Doc, thank you.
Mike, thank you so much. Appreciate you having me.
Thank you, sir. Bye.